Hi everyone, this is Fostalicious DIY Do It Yourself. Today I'm going to be discussing the topic what you need to know about miscarriages. What is a miscarriage? A miscarriage is the spontaneous ending of a pregnancy. It is also known as spontaneous abortion. It is an unexpected and unintentional death of an embryo or fetus before 20 weeks gestation. Unlike termination of pregnancy, which is intentional, that is, the woman chooses on her own to terminate or end the pregnancy. The difference between miscarriage and termination of pregnancy is the reason why they happen. Miscarriages are most likely to occur within the first 3 months of pregnancy. As in 8 out of 10 miscarriages happen within the first 3 months. About 10 to 20% of known pregnancies end in miscarriages. Some early miscarriages occur even before a woman knows that she is pregnant, while some others occur after pregnancy has been confirmed. Late miscarriages occur after 20 weeks gestation. In this case, it is known as stillbirth, and this is about 1%. This may actually be due to abnormalities of the uterus. What are the risk factors of miscarriages? Risk factors are threats or actions that increases or predisposes an individual to a certain condition. Number one risk factor is advanced maternal age. Younger women have lesser risk of miscarriage, while the risk is almost doubled in women who are greater than 40 years of age, because advanced maternal age increases the risk of chromosomal abnormalities, which contributes to age-related risk of miscarriages. Advanced paternal age do also affect sperm quality, and this can also lead to chromosomal abnormalities. By chromosomal abnormalities, I mean when the fertilized egg has an abnormal number of chromosomes, that is, genes. It happens at random, so you cannot prevent it from happening or cause it to happen. So it's good to be aware of that. Number two, certain health conditions in the mother, like diabetes, can increase the chances of a woman having a miscarriage. Severe infections or major injuries may also increase the risk of miscarriage. Exposure to radiation or toxic agents, environmental and workplace hazards. Improper implantation of the fertilized egg in the uterine lining may also cause a miscarriage. Hormonal abnormalities or irregularities, uterine abnormalities can also cause miscarriages. Incompetent service, in which your cervix begins to open up in the early pregnancy or at the middle of the pregnancy. Smoking, drinking alcohol, and consumption of illegal drugs. Thyroid disease, congenital heart disease, severe kidney disease may also cause miscarriages. Disorders of the immune system are seen in patients with autoimmune diseases. Some medications like isotretinoin used for the treatment of acne. This drug can also cause fetal abnormalities. Severe malnutrition. Prevention is better than cure. treat or control any maternal illness properly, and avoid risky behaviors. This increases your chances of having a successful pregnancy. Signs and symptoms of miscarriage. Signs and symptoms usually include vaginal bleeding or spotting, mild to severe lower abdominal cramping, mild to severe generalized belly pain, plus or minus low back pain or aches, pelvic pain, and passage of fetal tissue from the vagina. Other health issues may also present with the above symptoms, so do well to see your doctor immediately to be safe and for proper diagnosis and treatment of your symptoms. Women who have had 2 or more miscarriages in a row are more likely to have another miscarriage. So see your doctor for proper management. Nevertheless, miscarriage is a chance event. If you have had one miscarriage, your chances of a successful future pregnancies are still good. After you have experienced a miscarriage, if you continue to have heavy bleeding, fever, chills, or pain, contact your doctor immediately, because you may be having retained product of conception or an infection. Now, let's go into how you can properly care for yourself after you must have had a miscarriage. Use pads and not tampons, because you may be passing blood clots and fetal tissues. It is normal to have mild to moderate bleeding that is slightly heavier than your normal cyclical periods for about 1 to 2 weeks. Your next period should start 3 to 6 weeks after the miscarriage. Use analgesics for pain control. Eat balanced diets that are rich in iron and vitamin C, because you may be iron deficient because of blood loss. So you will need to eat food items like red meat, fish, beans, eggs, green leafy vegetables. These foodstuffs are rich in iron. Vitamin C rich fruits include citrus, tomatoes, broccoli, etc. Your doctor would tell you if you would need to take iron and multivitamin supplements. If you feel so sad or depressed for more than a couple of weeks, talk to your family, friends, counselor, or you can even talk to your doctor, as they can help you to elevate your mood. If you still want to get pregnant in the future, discuss future pregnancy plans with your doctor. If you have rhesus negative blood, you will need to get a shot of ROGAM, as this would prevent problem in future pregnancies. If you don't know your blood type, go to the lab and do blood test so that you can find out your blood type. If you do not want to get pregnant again, ask your doctor for contraceptives or childbirth control options. So, my dear people, I hope I've been able to enlighten you on what you need to know about miscarriages. Feel free to like this video, comment, share this video to everyone. You never can tell who would need it. And also be kind enough to like my page. Thank you very much, and God bless.